Hey there, it's Dr. Brian McKay, Core Health and Darien. Today, let's talk about back pain. Is it a muscle? Is it a nerve? Is it a disc? Is it a ligament, a facet joint? Well, we're going to address that today. Hopefully, you find this topic very exciting as I do, but maybe you don't. But listen, typically what happens is people come into my office and will tell me the back pain is muscular in nature, and I accept that part. But what people don't realize is that most of the times it's mechanical in nature and not just the muscle. The muscle is a component of the overall back pain issue, but it's not the end all that you may think it is. And here's why. The muscles help support and move the bone. Okay? Main jobs. Move and support. And ligaments support the bone, limit the motion, but again help support as well. So what happens is when you have let's just use a disc issue. Common things that people are going to have is a disc bulge. All right, you have a disc bulge. What typically happens is the material. It kind of depends on how serious it is. If it's a really bad disc bulge, you have the material the inside because the disc is there's a nucleus and an annulus. The annulus is the outer part. And typically, that's the annulus is what goes up and rubs against the nerve root. That's not mechanical. That's just not mechanical. I mean, no, I'm sorry. That is mechanical, not muscular. But the situation creates an unstable joint. So now the joint's unstable, so the muscles that attach to those areas, and you have these lot of little muscles in the back that are supporting us, and again help move those spinal bones. You got all these spinal bones that have little muscles that help move it and stabilize it. So what happens there is like it's just more of it's easy to say, hey, I have a muscle problem, and that's where the pain is. Okay, now I will give you this much: if you do take a non-steroidal, Advil relieve, you're going to stop the muscle part of the pain. But the pain, it's important to know is when you see a nerve that comes out of the spine, if you happen to be looking online, you see this one, looks like a cable. There's 9 different types of nerves in there. Only 2 deal with pain. So that's so you can if the pain if the muscle pain goes away, you may have and you still have a bulging disc. Your back is not any better. It's just that you're out of pain, which for some people that suffice. That's enough to keep them happy. Well, have at it. That doesn't bother me in the least bit. But what you got to think about here is the back pain is a lot more other things as well. Let's just use the example posture. Okay, what typically happens is these days people are just sitting down way, way, way too much. When that happens is you lose the normal curve. And when that curve is lost, what happens is it puts pressure onto it puts pressure all over the body. But so typically we call it a lordosis from the side. And it's like if you look from the side, it's a reverse C shape. That's the ideal thing from a mechanical standpoint. If you have a good curvature in the spine and the neck, the cervical or neck area and the lumbar low back area curves are called the good curve is called lordotic curve. And what happens is that the weight is able to support the curve supports the body's weight. So what happens is when you get degeneration, or it could be from poor posture, say you're carrying around a little bit too much weight in the abdomen, these things have a real big effect on the mechanical loading. And this is why I feel most back pains are mechanical in nature. So you have people sitting down, they're not exercising enough. The stomach muscles are weak. So what happens here is we got to really work to get these things working again properly in order to help support the spine. So the muscle component is never usually the whole issue. Typically, we have that bone that goes out of place for whatever reason. It could be poor posture for years. It could be you've been sitting down for 12, 14 hours during this damn pandemic, and you get degeneration. So this thing breaks down. We're not meant to sit as much as we are sitting these days. I mean, we sit down at our computers all day long. It's just the world of what we live in. What we got to do is we got to try to get you better and fix it. So what's important is probably okay, yeah, I'm a chiropractor, so I'm going to talk about putting that bone back in place. Something's out mechanically. Say you only put 3 lug nuts back on your car or on your wheel after you've changed the flat. Well, it just doesn't make sense. You got to put all 5 lug nuts on, or it's going to affect the wear and tear on the front end and the front. there's a lot of what are called comorbidities. So if the underlying thing, one of the things you recognize, if the bone's out of place, you got to put it back in place. It just makes it easier. You know, if you have a door off the hinges, you got to put them back on the hinges. It just makes sense. Put that back into place. Now, do you address the muscles? Hell yeah, hell yeah. But even more so, you got to address the disc issues, because that disc it wears away as you get older. And quite honestly, spinal decompression is the only way to really get that to move. You know, it's like, I want you to think about this. You go take a tube of toothpaste. Hopefully you um, get. Hopefully what you do is you get, you squeeze the tube, and what happens is when you take the pressure, there's a little, when you put it on your toothbrush, there's a little bit left in. When you release the pressure, the toothpaste goes back into the tube. And when that happens, that's what happens with decompression. Decompression pulls cerebrospinal fluid back into the disc space by creating negative pressure within the disc space, and that allows for the fluid to rehydrate the disc and help have it heal. So, but you take the physical stress, the mechanical loading off by correcting where the bone, we call it a subluxation. Then you decompress the disc, and then you do the right exercises, and that's how you're going to really heal a bad low back. So, I mean, yes, it's muscles. Yes, there's a muscular nature to a back problem. However, if you address all on several levels, okay, the ligaments not so much. Ligaments will move when you do the chiropractic adjustment, but it'll help hold the bone back into place. But usually these things go out of place with, either an accident or degeneration, and that's my job, is to find these things and fix it. So, you got any questions? You give us a call, 203-656-3636. 203-656-3636. I'm Dr. Brian McKay, Core Health and Darien, and hopefully you have a better understanding of why it's not always a muscular back pain. It could be from mechanical. Have a great day, and let's get this pandemic over with.